The pharmacy team within the Golden Jubilee are involved in all areas really of the hospital, and our key kind of business is making sure that we manage the medicines used within the Golden Jubilee and that we've got the right medicine at the right time for the right patient. So we've got pharmacy staff working in pre-admission clinics, we've got pharmacy staff working in all inpatient areas, and clinical trials are a few of the examples of where we work within the Golden Jubilee. We're part of the multidisciplinary teams within the hospital and link with all teams within the hospital, and I think the pandemic has certainly shown how important it is, all the different functions within the hospital and how pharmacy integrate with all of them. We had to think about how we were delivering medicines to patients within the Golden Jubilee, and one of the key things that we did throughout the pandemic was ensuring that medicine supply was always available for our patients within the hospital. There's issues across the whole of the UK around increasing use of particular medicines because of the pandemic, so we had to make sure that we had appropriate supplies to treat our patients within the Jubilee.
We had to liaise with national procurement, and they were given allocations of the most critical drugs to each health board, basically on a weekly basis. So it was quite kind of stressful having to make sure that you had enough for your patients, and then we started taking on new surgical procedures, and they were using drugs that we wouldn't normally use here, so they had to be sourced.
And you were hearing from colleagues down south where with the nature of the patients, they're using a lot more of certain drugs than you could have predicted. So, you know, prepare and get these in, and then you would get an alert, oh, that's out of stock now. A lot of the team had to speak into groups at a national level to say, okay, we have on this site this quantity of this medication, and a lot of the stock was allocated across Scotland and I guess probably across the UK. It was all redistributed. So many of the drugs were tightly controlled at a national level, just in order to make sure the stock was in the correct place at the correct time for the patients.
We were involved in all the discussions with the teams from the other health boards and the other professional groups across the Golden Jubilee to discuss what patients were coming over, what the impact of that would be in terms of the medicines that would be needed for those patients, and we made sure that we had a supply of these medicines, but also that we were able to advise on the appropriate use of those medicines, had protocols in place and managed the risks associated with introducing any new medicines that are not familiar to the clinical areas. So I think the new cancer surgical services that have been brought over was a significant increase in the work that we were doing within the Jubilee, but really satisfying when you see that the patients came over, were well looked after and had good outcomes from their surgery.
With the new cancer procedures that we've had, we tend to do a lot of in-house pharmacy training, so all of it has to be delivered via Microsoft Teams, but a lot of the other pharmacists, if you've maybe worked in another site before where these procedures have been on, have had a wealth of knowledge from their experience, and they've shared it with the team, and also linking in with colleagues across other sites to learn from them and to help us make sure that we can look after the patients as best as possible.
Although we were planning to be COVID light within the Golden Jubilee, there was always an acknowledgement that we may get patients that we needed to treat within the Golden Jubilee that had COVID, so we wanted to make sure that we had guidelines available for treating patients with COVID. We had the treatments available as the evidence was emerging, and we knew how best to treat patients with COVID. We needed to make sure that we had the medicines here on site, and also our clinical trials team in pharmacy were working with the wider clinical trials team to make sure that we were in a state of readiness and we were prepared if patients came and were wanting to recruit them onto the recovery trial, that everything was in place to do that.
So all our studies were suspended to recruitment, so there was no movement on any of the studies. The only ones that we were still able to do any work on were the ones with existing subjects or patients, because we had to give them the continuation of supply throughout the pandemic. They still had to get their medication. We were involved in some COVID studies, so that was the only one that they were allowing us to do, was this recovery study that we were involved in, which was a lot of work.
Early on in the first wave of the COVID pandemic in May, we sadly lost one of our very close members of our pharmacy team, Eleanor, who was a critical care pharmacist. She suddenly passed away, and that was a huge loss to our team. Eleanor worked within critical care. She's been here for many, many years. Eleanor taught me, she's taught so many members of the pharmacy team, so to lose her and to lose her wealth of knowledge, especially in a time where you needed critical care support, was a huge loss to the team. In a time where you need other people to pick you up and a bit of a light, she certainly was that, so we really do miss her.
We're now at a stage where we are looking to the future to see how we want the pharmacy service to move forward in the future, taking account of the last year, what changes we've made, any changes that we might want to continue. So we are starting to look and develop our pharmacy strategy for the future, and I think the COVID pandemic has really shown the importance of digital technology and how we can best utilise digital technology for the future, which was something we were considering and wanting to move forward with anyway. So the next kind of recovery phase is going to be expanding the electronic prescribing across the whole of the organisation and not just to critical care. The vaccine programme was a real challenge but a real opportunity as well. It enabled us to work really closely with a number of teams across the organisation. We had a vaccine team were convened, and we had representatives from across the whole of the Golden Jubilee. So it was a real team spirit and a real can-do attitude from everybody within the Jubilee to make this work, both for the Jubilee but for that wider societal benefits of vaccinating as many people as quickly as we could. Throughout the pandemic as well, we still trained our staff. We employed quite a number of new staff for the team, and staff development is still and always will be really important. So we've got one of the pharmacists who's just started their independent prescribing so that they can become a prescriber. So although we had all the challenges of the pandemic, we still maintained the development of our staff, and individuals maintained the development of themselves, which I think is only to be commended in amongst all the other challenges that we've had. And we've got one of our pharmacy assistants who's about to qualify as a pharmacy technician in the next month or two. So I think that's real success for the team, and just shows that the resilience of the team and the ability to really rise to the challenges that we had, but also add to developing themselves and the wider team.